It is a side effect of giving the vaccine, finding an arm for leftover doses and preparing for no-show appointments. Meghan Schiller talked with some local pharmacists who say it took some time, but they are now finding ways around the roadblock.
It used to be a major headache. People on 8 to 10 different vaccine lists and then failing to circle back when they found a dose elsewhere. Pharmacists tell me it's definitely a problem that they've identified and found ways to work around. The refrigerator sits ready with syringes nearby as pharmacist Jackie Bertola works to vaccinate her South Hills community.
Our clinics are also smaller, so we're doing, closer to, a few hundred, 500 at a time. We're not doing thousands and thousands of vaccines at a time.
She just posted this alert to the Primary Care Pharmacy Services Facebook page for another clinic this Saturday. Are you hearing of places having a bunch of leftovers? Or have you ever had any leftovers?
When we do, we chase people down, and if that means coming back to our pharmacy, calling people at 9 o'clock at night, stopping at their house on the way home, we're doing whatever it is so that we are not throwing those doses away.
She's one of a handful of ma-and-pop pharmacies around Pittsburgh still receiving shipments. So far, a good turnout here in West Mifflin.
And then people are pretty much showing up. I would say we have less than a 5% no-show rate.
Bertola only noticed no-shows for second doses.
Especially at that time when we were pushing our 28-day folks back into 42-day window, we were seeing that some of them got a little anxious and were seeking out that second shot as soon as possible.
Pleasant Hills Apothecary.
Not far away, Pleasant Hills Apothecary says when it comes to preventing leftover vaccine doses, it's all on the draw.
At the beginning of the day, if we're expecting to have 800 doses, we might draw up 200 shots to start the day just to get us going, and then we'll fill more shots and draw more shots as the day goes on.
Pharmacist Luke Taylor said they're using email registration and sending the invites closer to the date of the clinics here at TJ High School.
There hasn't been a clean answer so far. It's just been more legwork where we send out emails, give those people a couple days to respond, and then we'll send out a second round of emails to fill the rest of the clinic.
As for the healthcare giant, Allegheny Health Network says it does have no-shows from time to time, but nothing they would describe as a major issue. They say that they will mix and open the vials as the patients arrive, so they won't have any doses open and waiting for people. UPMC says it does the exact same thing to limit any waste, saying that they will get the last drop into their patients. Reporting on the North Shore, Meghan Schiller, KDKA News.